Good evening, CPA students. My name is Miss Baldwin. Today we are going to be covering the basics of healthcare, chapter 14. Some vocabulary that we're going to start with to help better understand the chapter as we go through it. First being beneficiary. What is a beneficiary? The beneficiary is the recipient of the health benefits, the health insurance benefits. What is an explanation of benefits, or EOB? This way you'll see it abbreviated most times. This is a document that's going to be sent by the insurance company to the provider and the patient, explaining all allowable charges and amounts, reimbursed for services, and the patient's financial responsibility. This is the piece of paper that patients get, and they will call the office thinking that it's a bill. It is not a bill, it is just an explanation of the benefits. They get that confused a lot. I see it a lot out in the healthcare setting. Deductible. What is a deductible? A deductible is a specific amount of money that the patient must pay out of pocket before any insurance is going to be paid. That has to be paid up front. Who is the gatekeeper? The gatekeeper is the primary care provider who can approve or deny when the patient seeks additional care via a referral to a specialist or further medical testing. Who is the subscriber? The subscriber is the person who is the signer of the health insurance policy. On page 262 in your book, if you're following along with me, to highlight and make notes in it, the purpose of health insurance is a monthly premium or a payment of paid. A payment is paid for a list of health insurance benefits detailed in a contract. The premium can be paid by the employer if the subscriber is employed with benefits, or it is paid by the patient for individual coverage. Contract with patients. Health insurance plans typically cover services and procedures that are deemed medically necessary, or health services that procedures are necessary to improve the patient's current health condition. So they have to be medically necessary, has to be something that they need, cannot be an elective. Which brings to the next point. Most insurance policies will not cover an elective procedure. That's something that does not need to be done to sustain that person's health, such as a facelift. Most of today's health insurance policies cover preventative care, which includes services provided to help prevent certain illnesses or lead to early diagnoses. Employer-sponsored group policies. In the past, businesses have offered full-time employees health insurance as a group policy. A privately sponsored health insurance plan purchased by the employer for a group of employees. Group policies usually provide greater benefits at lower premiums because of the large pool of employees that they do have. Often the employee shares the cost of the monthly premium, normally will be payroll deducted, so that you're never really seeing that money be gone. It's just coming out of your paycheck on a monthly or weekly basis, depending on how you get paid. Benefits. Every health insurance contract is tailored to the needs of each individual or group policy, and the combination of benefits are limitless. Benefits cover the amount lost or the amount that should be paid to the healthcare provider for services that are rendered. Employers can pick or choose the benefits they want for their employees. This is called the cafeteria style. Sorry about that. Hospitalization on page 263. Hospitalization covers coverage pays the cost of all or part of the patient's hospital room and board, including specific hospital services such as hospital surgical room fees or a hospital stay of less than 30 days. On 264, if you're following along with me, Medicare supplements, Medigap policies. They are going to be what covers the difference between Medicare reimbursement and the patient's financial responsibility. It's going to cover that gap in between that. So on page 266 in the book, under verifying eligibility of service. So this is the process of confirming health insurance coverage for a patient for a medical service on the date of the service. Must find out if they're eligible on the date of service. It's very important for the patient and for the insurance for the facility itself. This is how everybody's getting paid out of pocket. As a medical assistant, it's going to be your job to verify the effective date and the date the insurance began, and confirm that the patient is covered on the date that that medical service is being rendered. Otherwise, it will be kicked back. The medical assistant should also make it a practice to try and review the online insurance web portal. This is where you can verify insurance eligibility, benefits, any exclusions prior to the patient's appointment. Makes it handy. You don't have to get on the phone and spend a lengthy amount of time on hold with insurance companies. You can do it through the web portal. It makes your life and everybody else's life a lot easier if you can get familiar with that in the future. So moving along to participating provider contracts on page 268. So these are government-sponsored healthcare plans. Most privately sponsored healthcare plans, healthcare providers must become participating providers to these plans. So they're called PARS, P-A-R''S. These providers are contracted with that insurance plan, and they have agreed to accept whatever fee schedule that insurance has. So if your office normally pays or charges $100 for a service, but their fee schedule or contract says that they're only paying $25, they're only getting paid $25 out of that. So it's very important. I've got an example on the PowerPoint that I've sent you of just kind of estimating how to figure out what your deductible is, making sure you're taking that off because that's got to be paid first. Your co-payment, figuring out what your insurance is going to pay. In this example, I've put the insurance paying at 80%. So I've done the math on there, so you can refer to that just to kind of give you an idea of how to figure that out. Okay. Contracted fee schedules, the allowable charge or the allowable amount. It can be called either one. I think in the book it calls it allowable charge, but you will hear it called allowable amount also, is the maximum that the third party will pay for a procedure or a service. So how reimbursements are determined, there's several different ways that they can be determined. The determination of a usual, customary, or reasonable fees, the URC, the indemnity schedules, the service benefit plan, or the resource-based relative value scale. So RBRVS, so is how that one would be abbreviated. Okay, what are managed care organizations? You'll see them abbreviated MCOs all the time. Most of the time it's not going to be written out as managed care organizations. They're a type of healthcare organization which contract with various healthcare providers and medical facilities to reduce payments, payment schedule for that insurance member, okay? MCOs, managed care organizations. Your independent physician association, or IPAs, is an independent group of providers and other healthcare professionals who are under contract to provide services to members of different HMOs. In addition to other insurance plans, usually at a fixed fee per patient. Staff model. Again, if you're following along, I'm on page 271 now. A staff model HMO hires salary healthcare providers rather than contracted with providers to create a network. The HMO is what owns the network. Your health maintenance organization, that's the HMO, typically have the lowest monthly premiums, along with other health insurance plans with lower patient financial responsibility. This again is on page 270. Patients are required to select a PCP or a primary care provider with these plans, and this is who acts as their gatekeeper to the more specialized care, because the gatekeeper again is going to be who is going to refer you out to specialists. So, like we talked about in the beginning. So as far as referrals go, again, if you're following along, I'm on page 272, or if you're following along on the PowerPoint, either way. Regular referrals usually take 3 to 10 working days for review or referral. Your urgent referrals usually take 24 hours before they are approved. These are used in urgent but non-life-threatening situations. Your stat referral can be approved online when submitted to a utilization review department through the provider's web portal. A stat referral is used in emergency cases that is indicated by the provider. It has to be indicated by the provider that this is a stat referral. Sometimes in those situations, the provider may have to get on the phone and speak with the insurance or for that referral. So. Your pre-authorizations for surgical procedures, all of your managed healthcare plans, including your HMOs, your PPOs, your EPOs, require pre-authorization for any medical service, such as surgery, expensive medical testing, and medication therapy as well. Your government sponsored plans. So I'm sure most of you have heard of Medicare and Medicaid. So the way you can to remember it, Medicare is for people who are over the age of 65, and Medicaid is more for the low-income patient to be eligible to qualify for those programs. So we're going to start with Medicare. So Medicare was established in 1966. It's, again, like I said, for individuals who are 65 or older, also the disabled, or patients with diagnosed EDSR, which is end-stage renal disease. Medicare is the world's largest insurance program. There are 4 different parts to it. So you got Part A. Medicare Part A is for hospital insurance. Medicare Part D is for ambulatory care, including primary care and specialists in that. So, and then Medicare Part C is an option for Medicare qualified patients to turn their Part A or their Part B benefits into privately sponsored plans for a set fee. And then Medicare Part D is for your prescription drugs. So it's a lot to keep up with, but I just make yourself familiar with those different parts of the Medicare and how it works. Okay, so moving along to Medicaid on page 275, if we're following along in the book. In 1965, the federal government provided for a medically indigent program known as Medicaid. So the medical office has the right to limit the number of Medicaid patients they accept to their practice for financial reasons. This is because so there's going to be a lot of places that you work that you don't accept Medicaid. The last place that I was at, they were not in network with Medicaid for this reason. Their fee schedule is the lowest of all insurance companies, and it is probably not at the best interest of the medical's office financially, their interest to accept Medicaid patients. So that is unfortunately why a lot of places do not accept Medicaid programs, so, or Medicaid patients. Okay, so if you know anything about TRICARE, the military, if you're military yourself or family's been military, you probably heard of TRICARE before. So this is a civilian healthcare program known as TRICARE. The healthcare program is for all 7 of the ununiformed services, so the Army, Navy, Marines, Air Force, Coast Guard, Public Health Services, and also the National Oceanic and Atmospheric Administration as well. So CHAMP VA. So CHAMP VA is a civilian health and medical program of the Veterans Administration. Sorry, I'm getting tongue tied. This is a program that is similar to TRICARE, but it's for the spouses and the dependent children of veterans suffering either total, permanent, or service-connected disabilities, and their surviving spouses and dependent children who died as a result of a service-related disability. So that covers and protects them. So workers' compensation, I don't know if anybody has ever been injured on the job and had to fill out any paperwork for workman's comp, and kind of familiar with that, but it is a plan that's for individuals who are injured on the job, either by accident or an acquired illness at work. So it's to cover us when we're out in the work field too. So then you have your employer established self-funded plans. So many of your large companies or organizations have enough employees that they can fund their own insurance program. These are what's called the self-funded plan. So I am going to send out an assignment later on, and we're going to do some writing on, I'll let you pick one of the different insurance plans that we talked about, whether it's TRICARE, CHAMP VA, Medicare, Medicaid, and I'll go over in more detail with that, and I'm going to send some videos along with it. So I hope you all have a great day, and if you have any questions regarding Chapter 14, please feel free to contact me. Thank you.